Mrs. Condry. My name is Becca. I'm going to be your student nurse today from UNE. How are you feeling?
I'm alright.
Do you have any pain?
No.
Oh, that's good to hear. Can I just check your name band? Can you tell me your first and last name and date of birth?
Caitlin Condry, 9/20/88.
Perfect, thank you. And do you have any allergies that you need to be aware of? No? Okay, that's great. So today we're just going to be doing like a bedside assessment, making sure everything's going okay for you. Let me know if at any point you have any pain or discomfort. I'm going to start by just, if you're more comfortable, do you want to just sit on the edge of the bed? Yeah, that'd be great. Okay. And we're just going to start by, I'm just going to ask you a couple questions. Can you tell me your name again?
Caitlin Condry.
Okay, and you tell me what the date is today?
April 24th, 2019.
Great. And can you tell me where you are?
Old Orchard Beach, Maine.
Yeah, perfect. Okay, so you did okay on that. I'm now going to ask you, I'm just going to give you 3 words, and you're going to try to remember them, and at some point later I'm going to ask you to repeat them, so try to remember them. It's going to be horse, banana, skateboard.
Horse, banana, skateboard.
Okay, so try to remember those. We're now going to look at your eyes. I'm going to be looking at your pupils, so if you could just look straight ahead for me, and just look straight ahead. Keep your eyes open. Figure out how to work this. Oh, there you go. Okay. Okay, the pupils are round and equally reactive to light. An accommodation. I'll check the accommodation. Okay, they're accommodating too. And also, just to note, her speech is clear, her behavior is appropriate. I don't see any outstanding lesions so far looking at her, the skin that I can see. Okay, so we continue. I'm going to assess your scalp a little bit if you don't mind. I don't see anything. I don't feel anything abnormal. I don't feel any lesions. I don't see any critters or anything in there, so your scalp looks healthy. I'm going to look further at your eyes, more of an assessment. Okay, and I'm going to do a couple more vision tests on you. So we're going to I'm just going to have you follow my finger as I move it. Try to not move your head, just your eyes. Sorry, almost done. Okay, good. Take a break from that. You had like one nystagma when I did the lateral, but that's okay, so that's normal. We're now going to look at your peripheral vision. So you're going to cover one eye, and then I'm going to bring my hands into your side of vision. Let me know when you see them, okay? My hands.
Saw them.
Okay, that looks good. I'm going to come from below too, so keep the eye closed. Above and below. First above, let me know when you see it.
Saw it.
Okay, and below.
Saw it.
So weird. Okay. Now we're going to do the other eye. Your peripheral vision looks good on that one, so cover the other eye. And I'm going to come from the sides again. You just looked. Try to keep your eyes looking at me the whole time, please. Okay.
Saw it.
Okay. And we're going to come. Don't look up. Like, try to keep your eyes straight at me. Just with your peripherals. Okay, and one more time. Keep your eyes looking at me while I do this.
Saw it.
Okay, perfect. So your peripheral vision looks good. We looked at, I think that's all the vision tests. Okay, so we're going to move on to looking at your nose. I'm just going to have you look up so I can look into it with this light really quickly. Okay, I'm inspecting it for nodules or lesions. I don't see anything abnormal. It looks healthy. I'm going to look at your ears next. I'm looking inside. I don't see any swelling or indication of an infection. I'm just going to pull in your ear. Let me know if you have pain. Is that okay?
Yep.
And press on your tragus.
No pain.
No pain. Check the other one the same way. I'm looking inside. Don't see anything abnormal. Let me know if you have pain.
Nope.
Nope. Okay. Your ears look good. I'm just going to have you open your mouth now. And say ah.
Ah.
The uvula is hanging down symmetrically, so that's a good sign. Overall, your face looks symmetrical. If your skin is dry and intact, I don't see any unusual lesions, so that's a good sign. I'm going to be moving on to your neck now. So you're just going to, first I'm going to just assess that your trachea is midline. I don't see any deviation to left or right, so that's good. So yeah, your trachea is midline. I'm going to find your thyroid, and can you swallow it for me? Okay, I can feel the thyroid going up and down. It feels like there's no thyroid enlargement or anything abnormal, so that's good. I'm going to look for right jugular vein extension. So can you turn your head? That way I'm looking at the right side. Technically, I guess you're supposed to be 45 degrees in the bed, right? Should I? Okay. Don't see any neck vein extension. You can come back. I don't know if we have to actually do that, but no, I don't see any vein extension on her neck, so I don't think she has jugular neck vein extension. I'm going to use the bell now to listen for bruit and then this vein. Okay, this time I'm going to have you take a deep breath and hold it. So breathe in. Okay. I don't hear any bruit. So that's good. I'm now going to feel for your carotid pulse on both sides. That side's definitely strong and regular, +2. And this side's also +2 and regular. So that's good. Great. So I'm now going to be moving. Oh, just before we leave the neck, can you show me kind of like your neck range of motion? So look down and then look up and back a little bit, hyperextension and lateral flexion. Do you have any pain or anything abnormal when you're moving your neck? Okay, that's great. All right, so your neck looks great. We're gonna move on to your chest area. So I'm just gonna check your skin trigger around the clavicle. Good, you don't look like you have any dehydration or tenting. Oh, oh yeah, I should do that now. Actually, I forgot, for your face and your neck, I'm going to check for your sinuses and your lymph nodes before I forget, because I might as well do that now. Okay, so we're going to do like your maxillary sinuses. Do you have any pain when I'm pressing here in your frontal? Okay, and I'm going to look for your lymph nodes. So do pre-arcular, post-arcular, occipital, tonsillar, submandible, submental. I guess I should be doing both sides for all these. Okay, tonsillar, submandible, submental, anterior clavicle chain, posterior clavicle chain, and supraclavicle. Okay, almost forgot that. Okay, cool. So we're now going to move on to your chest area. I'm going to listen to your lungs first. So every time I move the stethoscope, can you just take a deep breath in and out through your mouth? Mm-hmm. Okay. Don't mind, I'm going to go under the shirt for the lateral. Okay, great. Thanks for the deep breaths. Take a break from that. I'm going to do the heart sounds now. So you just sit still. Sorry. Okay, so forgot to mention for the lung sounds, the lungs sounded clear, no abnormal lung sounds. For the heart sounds, S1 and S2 were noted and regular. Should I do it again with the bell? Or just mention, I would also check with first the diaphragm and then the bell. So yeah, but the heart sounded good. How about before we move on to the back, we revisit those words I told you in the beginning. Do you remember what are those 3 words?
Horse. Banana.
One more.
Backpack. No.
Skateboard.
Skateboard.
But so your short-term memory
It's not
isn't
there.
too all the way there, but you got some of it. And I also just remembered my own short-term memory reminded me you didn't do your whisper test.
Oh, yeah.
So I'm going to have you put your hand on your tragus, and then on this side I'm going to whisper a word, a 2-syllable word.
Sunshine.
Yep. And then the other side.
Lawnmower.
Cool. Okay, so you got the hearing good. Just the short-term memory wasn't perfect, but that's okay.
Yeah.
All right, I think that was everything that we forgot. Moving on. We are going to look at your back a little bit now. So first I'm just going to listen to your lung sounds in your back. If you could just turn a little bit, that'd be great. So same thing as the front. Every time I move this stethoscope, just take a deep breath in and out with your mouth. Sorry. Okay, thank you. Your lung sounds again sound clear and normal, so that's good. I'm going to assess your back a little bit more. If you don't mind standing up, that would be great, and just face that way. I'm assessing the back for any lesions or ulcerations or anything from being in the bed. Her skin looks dry and warm, and I don't see anything abnormal in her back. Her spine, does that hurt when I'm touching around the spine? Okay, so I'm just going to have you lean over for me so I can see if you have any. Looks like her shoulders are at the same level, so she doesn't seem to have any like scoliosis or anything like that, so that's a good sign, and her spine looks normal. You can stand up again, and I'm going to look for your bilateral chest expansion. So if you just take a really deep breath. Okay, take another deep breath. Okay, so when my hands were on her, my hands went up at an even height, so that's a good sign. Her chest seems to be expanding bilaterally, so that's good. While you're standing, we're just gonna check your gait. So why don't you walk to that like door and back slowly while I look at how your gait is going. Okay, good. Seems like she has a really healthy gait. Normal posture. She doesn't seem unbalanced in any way, so that's great. You can go ahead and go back to the bed now. Well, you can sit down. Yeah, that's great. Okay. Was there anything else in the back? I think that's good. Okay, so we're going to look at your arms now. Can you just show me some range of motion? Like we're gonna flex our elbows up and down, and then lift our arms, abduction and adduction. And like this way, like look at the shoulder joint and then extend it back. And then, yeah, I think that's most of the movements. And then for your hands, just like up, protonate and subprotonate, okay. And then can you pull, and look at your strength, you're gonna pull, okay, and push. Her strength looks good, her range of motion looks good. I'm gonna look at your arm strength as well, so try to push up against my arms, okay, push down, good. So she has normal bilateral muscle, yeah, I'm gonna do that, but normal bilateral muscle range of motion and movement. I just love saying that. That's good. I'm now gonna look at her hands a little more closely. First, her radial pulses. Okay, good. So on both sides, she has +2 regular rate pulse. I'll look at your fingers. She has capillary refill that's less than 3 seconds. And I don't see any swelling in the fingers or edema. Could you feel when I was touching your fingers?
Yes.
Do you have any pain in your hands
No.
or wrist? Okay. Oh, just also do the wrist joint. Can you go like this? Okay, cool. I think we covered all the range of motion for your arms. Okay, so now you can go ahead and lie down because we'll be looking at your abdomen. Wish I could raise the bed. My bed, this one doesn't raise just because like that. Are you comfortable like that?
Yeah.
Okay, so I'm going to look at your abdomen. If you don't mind, I'm going to move your shirt up a little bit. Sorry. Okay. So first of all, have you been tolerating your diet okay?
Yes.
Do you have any, like, nausea or vomiting? Or
No.
Okay, that's good. I'm going to first, just inspecting it, I don't see any lesions. The skin looks healthy. I don't see any distension of the abdomen. It's soft and looks pretty normal. I'm going to now auscultate for bowel sounds, starting in the lower right quadrant. Oh, a really loud one right there. Okay. Plus 4, so there's bowel sounds in all 4 quadrants. That's a great sign. Now I'm going to palpate all 4 quadrants across. I'm going to start with light palpitation. Let me know if anything's too painful, if you have any tenderness. A lot of abs. Every time, like, I just feel her abs. Okay, I'm going to do a little deeper, try to get past those abs a little bit to feel for the structures. See how everything's... Okay, I don't feel anything abnormal or enlarged, so that's good. Do you have any tenderness when I'm doing that? Okay, great. So your abdomen looks great. Put that down. Can you tell me when your last bowel movement was?
Yesterday afternoon.
Was it a regular,
Yes.
Okay, good. So it looks like your bowel's working great. I don't see any, like, distension in the, like, that would indicate a bladder, distension either while we were there. Okay, I'm gonna look now more at your legs. So first, I'm just gonna assess the strength of your legs. Can you try to, like, push your legs up against like that? Okay, and then down here. I don't know if that's how you check that. Okay. Now
no, I don't remember.
you're gonna push against my hands. Okay, good, and then pull back. Good. So you have strong strength in your feet. I'm gonna have you bend your knees up to look at your, like, range of motion in your leg. Great. Yeah, and then you can put them back down and just, like, lift one leg up and the other. Yeah. Great. So range of motion looks good. The range of motion of the feet was good when I did the strength test. I'm gonna look at the pedal pulses. So the dorsal pedis pulse first. I'd say it's more like +1, but it's regular. And then I'm going to look at her interior, her posterior tibial. Okay, there we go. And that is also +1, but regular rhythm. I don't see any edema or swelling in your leg. I'm going to assess for capillary refill in the toes as well. Can you feel when I'm touching your toes? Okay, that's a good sign. And you have capillary refill is less than 3 seconds. Yeah, do you have any pain or tingling or anything in your feet? Okay,
Nope.
That's great. All right, so I'm going to give you this call light. So if you need anything from me, you can let me know.
Thank you.
Anything else you wanted to address while I was here?
No.
Okay, I'm gonna make sure your bed rail is up and the bed is lowered all the way down. Okay, great to see you. Call me if you need anything.
Thank
Wash
you.
your hands.